What's the difference between Medicaid and Medicare? Now, they are both federally funded and managed by the states. A huge difference when it comes to estate planning and elder law is that when evaluating Medicaid and Medicare, Medicare can only pay for short-term rehab or rehabilitative care. They're not allowed to cover long-term care. For example, if a person breaks their leg and is in rehab and they get better, Medicare will cover it. However, they can only cover certain amounts of care that is rehabilitative. But if a person has a type of health condition that is not rehabilitative, meaning that they are not getting better, Medicare is not allowed to cover it. It's now a long-term need, and that's where Medicaid kicks in. Medicaid is kind of like a safety net. It covers everything that's medically necessary that Medicare does not cover, which is long-term care needs. And these needs are typically very expensive. Therefore, Medicaid planning for long-term needs are essential for most people's budgets, especially if you have assets and income that you rely on. Understand that these assets can be shifted into an irrevocable Medicaid asset protection trust, which provides Medicaid eligibility. However, to avoid Medicaid recovery, those assets need to be transferred into the Medicaid Asset Protection Trust within 5 years before the recipient applies for Medicaid benefits.